Hey guys, as you can see, I'm actually wearing a shirt for this video, and I'm sorry that this setup is really bad, but I am wearing one of my scrub tops, and I'm not just wearing like a towel or like a tube top, whatever. I'm actually being modest today, and I'm wearing my Skechers scrub top, and I have matching Skechers scrub bottoms, my favorite pair to wear. I don't feel like fat, to be honest. So yeah, so I have 3 pairs of Skechers now, and that's like all I wear. This video is basically going to be how I get ready for work. I'm not gonna like do my makeup in this video, but I'm gonna do my makeup. And yes, I do my makeup for work. One of the girls I used to work with, she was like, why are you wearing makeup? Like, I wear makeup all the time. Like, I really hate people like seeing me in public with like no makeup on. Not that I'm like trying to impress people at work, but like you never know who you're gonna see there, and like I really don't want to look like I'm 12. You know what I mean? Do try and put effort into what I look like when I go to work, because you never know who you're gonna meet, you never know who you're gonna see, you know, so why not like try to look good? Not actually going to work tonight. This is just like, I'm just doing this like for the video purpose. But usually I wake up around 5 p.m. and then I try to leave my house by 6. Sometimes I get to eat before I go in, and usually I don't straighten my hair, but today I did just because like I'm going to dinner after I make this video. So usually I don't straighten my hair. Usually I'll get a shower when I wake up and I'll scrunch my hair, or I'll do like braids, and then I'll be like kind of like beach waves hair. I usually will like do like a half like clip back look when I go to work, like no matter like the hairstyle, that kind of like keeps it on my face. So after I'm done my makeup, I'm gonna show you like what I normally would wear to work, and then I'm gonna show you what I take to work as far as like supplies and like equipment, and then I'm gonna tell you about what I do during the night shift. So if you are interested in what a night is like in my life as a nurse, then keep watching. So I just got done getting ready, and this is the makeup look. And I always put my scrub top on like before I put on foundation, because sometimes, you know, if you're putting on a navy scrub top, you can get like foundation on it when you're like putting it over your head. I always wear a scrunchie on my wrist. I always like put it up. Usually I wear like an undershirt underneath this, but like I'm not actually going to work, so I don't have it on now because I'm like sweating. But I usually keep it like up here or like under my long sleeve shirt, just because when you're like wiping people and cleaning them up, like you don't want the scrunchie that's gonna like go in your hair potentially to like go in someone's like butt crack, you know what I mean? So I usually keep that on. And then on this wrist I wear my Apple Watch, and I wear this cheetah print, obviously, band. Then I have this other hair tie, which I just always have on my wrist. But yeah, this is nice. So like throughout the night, I can just like, oh, like I'm going in to like clean someone up, I'm going in, give a med through like an NG tube, like you just done. Like, okay, I'm gonna like wipe you now, you know what I mean? So like it's a quick like little scrunchie, it's cute, it's whatever. The other thing I wanted to show was the new Danskos that I got. They are cheetah print. I haven't worn these yet to work. I really want to, but they keep flipping off the back of my feet, and I like, my one friend told me that it was normal, but they were like flipping off, and I don't want to be like running down the hall for a bed alarm or like to a code or something, and then my shoe like fly off, you know what I mean? So I don't know. I have them on now, but I'm gonna show you then the shoes that I actually wear all the time when I'm actually at work, because I've worn them religiously like since I've started. But I really want to get into the Danskos, but I'm gonna try to show you Skechers brand. So yeah, I just think these look like really nice. Okay, so I just got into my car, and I'm just gonna film the rest of this in my car because that's where I keep my work bag. It's only 4 o'clock, but usually when I come out it's 6. It's dark out because it's winter time right now. But I wear this jacket to work, and then usually I wear like my winter jacket on top. And then these are the shoes that I've been wearing. I know it's really gross that I'm touching them right now. Don't worry, I'll wash my hands. But these are from Kohl's, and they're Under Armour. They're like super comfortable, rose gold, like They're super cute. I get so many compliments on them, and they're so comfortable. And I've been wearing these since I started, and I just think they're amazing. I'm going to show you the supplies I take to work. I'm going to kind of go over like what I do at work. This is my work bag. It's Nike. It's a backpack. It's getting kind of dirty because it's like obviously like light pink, but it's just a cute little backpack. So first thing, I've had this for forever. This is my clipboard papers and stuff I'm using for the night. I'll clip here, and then like inside I have like a little notebook, papers that are like pertinent, and if not, like I throw them away. But I'll get to like the report sheet that I use for work then, because I have an extra one in here. I have my stethoscope, which I just got this one on Amazon because someone stole the one that I've used like my whole nursing career so far, like a couple months ago. So the one aide that I work with, I used hers for like a month, and now I finally got my own. This is rose gold, and it's supposed to be like marble. I don't know if you can even tell, but it's already turning navy. I have this rose gold. Everything's like rose gold and navy. That's just like my colors, I guess. But then this is rose gold. It says resting nurse face. Got this from Charming Charlie like before they closed. And then inside I just have like a bunch of pens and my keys, and these scissors are the scissors I use cutting dressings, cutting like medication packets open, like Miralax or whatever. But these are super cute. They're from Amazon. Random supplies like dry erase marker. I have like a mini Sharpie attached to like my keys, and tape. I have this little bag, rose gold too, and sparkly, go figure. So I just have like some tampons in here because you never know, some tissues, some extra contacts because I don't know, in case something gets in my eye and I have to change my contacts. Usually sometimes I take my glasses, but like I usually forget. But that would be a good idea, like to take your glasses if you wear contacts like I do. I go over kind of what I do. So get in my car, go to work, usually stop at Dunkin' Donuts on the way, get a coffee, and then I get to work. And so when we get to work, there's a whiteboard of like our patient assignments. So usually I have like 4 to 5 people, patients, and it says like the room numbers, and it has like my picture and then like the room numbers. And then sometimes like I'll have like 4 people, so then I know I'm probably gonna get like an admission overnight, or I'll have 5 and I'm usually like steady at 5. It all kind of like depends, like every night is different, but usually it's like 4 to 5 people. Sometimes it's 6. One time it was 3, but like for a couple hours until like I got a 4th person, just because like the assignments were messed up. But like usually it's 4 to 5. So I look at that, and if I've been there for like multiple nights in a row, or like if I was there on a Saturday and now I'm going back on a Monday, like I might have the same patients. So if I go like 2 nights in a row, usually I will have like the same patients from like the night before. So then I really don't have to look up like their information, like look at their notes, like why they're there and everything. You go in, you look at your like patient assignment, and you're like, okay, like this is why they're here. This is like their name, their birthday, their age, like their code status, like are they a full code, or are they like do not resuscitate, why they're there, like the plan of like care and everything. And usually I have time to look that stuff up, but sometimes like if I'm getting there a little bit later, I just wait until I get report from the day shift nurse. So report usually takes about a half hour, from like 7 to 7:30 in the evening and in the morning, like when I give report to day shift. So that takes about a half hour, sometimes shorter, sometimes longer. If it's like shorter, probably because like I've had that patient already, or I don't have like a lot going on. But sometimes it takes longer if they have like an extensive history, if they're there for, you know, like weeks and they have like all these other like comorbidities and stuff, then you have to take longer. Anyway, so we do report. Sometimes we have to like hand off medications before we leave, like heparin, PCA pumps, if our patients have those, which like isn't that common, but like I've definitely done it like multiple times since I've been an RN. So introduce myself to the patient, say, hi, I'm Miranda, I'm going to be your nurse tonight, like let me know if you need anything, I'll be here till 7:30 in the morning, you know what, I'll be back in, we'll do your meds, we'll do your assessment, and is there anything I can get you right now, you know? And then like the day shift nurse will be like, okay, like have a good night, bye, like whoever your name is, like bye. So I go say hi to all my people. If they need anything, like at the moment, like maybe someone needs like a pain medication, okay, like I'll be right back, like what's your pain level at, like then go get them like their appropriate pain medication, like Tylenol, Toradol, Dilaudid, Tramadol, Percocet. So after I go say hi to everyone, I kind of like organize my night, and I do have like a notebook piece of paper in my little clipboard thing because it opens up. But I usually will write down like the medications I have due. Like there's a lot of like usually 9 o'clock meds, and then sometimes like 6 o'clock, 6 a.m. meds, but then there's like medications in between there. So it's usually like anticoagulant, so it's like heparin, Lovenox. Give heparin at like 1 a.m., 2 a.m., 3 a.m. Like, hey, I have to like stab you right now in the belly, like give you your heparin, but like, what are you gonna do? Like, you have like your IV antibiotics and like your IV fluids. Some people, depending on why they're there, you could be giving like 3 different IV antibiotics like throughout the night. So like sometimes I'd be giving like Flagyl every 8 hours, and then they get like vancomycin, and then they get like cefepime, all different, you know, because they're infection. Usually it's because they're septic. We give like a variety of like IV antibiotic medications. Have to empty drains, so I time that. Like usually when I do like my assessment on my patient, which is like, you know, head to toe, so I'll go over like that on the report sheet. This is the report sheet I use, but you know, head to toe assessment, like are you alert, are you oriented, does the person know where they are, like are they with it, are they confused, do they sundown, like do they have dementia? And then you know, it's a full like head to toe assessment, like listen to their lungs, their heart. This is the report sheet. Let me hold it. So basically like the room number, patient's name, age, their code status, if they're in isolation, like why, their chem stick, that's another thing. If they're diabetic, are we checking before meals and before bedtime? Are we checking Q4 hours or Q6 hours? Is the patient alarmed? Do we turn them? If you don't know what any of these things mean, just like ask me. But like why they came in, and then the date, their history that's like pertinent to why they're here now, any surgeries or procedures they got, because we do have to do documentation on their surgeries. This says IV, but it's like cut off. Do they have an IV site? Do they have fluids going? How they get out of bed? What they get for pain meds, allergies, their skin, what that looks like. Usually put like, if they have like a laparoscopic surgery, I'll put like lap sites with 1x2s, like old drainage, and then like they have a JP drain or like an ostomy, you can write that there. Their diet, are they MPO, which means nothing by mouth, because maybe they're having like a surgery, or they have like a small bowel obstruction or an ileus or something. Are they alert and oriented? Do they have a heart monitor on? Are they wearing oxygen? What do their lungs sound like? Do they wear CPAP at night? Are they using their incentive spirometer? Last bowel movement? Are they nauseous? How their bowel sound like? Are they hypo? Are they normal? They're hyper. Or do they have diarrhea? GU system. Are they continent? Are they incontinent? Like, are they peeing themselves? Do they pee in the urinal, in the bathroom? Do they have a condom cap? Do they have a Foley? Do they have a CBI? Do we need a bladder scan then? Sometimes we need a bladder scan if they had surgery and they had a Foley in. Are they putting out enough urine? Are they retaining any urine? Any notes that I have about like their plan of care I put here to do. I usually put like if their daily weight here, specimens to collect like a urine or like a flu swab or something. Lab data, so like if my patient has like hematuria, if they have blood in their pee, like I'll keep track of their hemoglobin over here. Or if they have like, or if they're septic, I'll put like positive blood cultures. If their white blood cell count is like crazy, like I'll put that, and like I'll trend that over there. If they have like acute kidney injury, I'll put like their creatinine, BUN. What else? Like if they're on heparin drip, I'll write like their INR level. Yeah, and then like from home with wife is usually what I write. From home with husband. Sometimes they're from like nursing homes or group homes, so we write that down. anticipated discharge date. Sometimes it's usually like tomorrow or a couple days. And then are they going to a skilled nursing facility, or are they going home? Are they going to rehab? Like kind of like their disposition when they're discharged. So that's kind of like all right here. This is like everything that we need to know. That's like the information that the day shift nurse gives us. And then like our job, because we're like night shift and sometimes there's like downtime and whatnot, we'll like go into the chart and like maybe they're going to rehab and the day shift nurse like doesn't know that, so we'll just like take note of that and then hand that off like to the next person coming in. But yeah, that's basically like the report sheet, and we go over all that, and then anything that I see from the assessment that's like new or like a change, then I will like write that on my sheet throughout the night, and then in like a different color usually, and then I'll like update the nurse if she's coming back in for the next day shift, or like I'll tell the next nurse like, hey, like this was a change, whatever. By the time I go see everybody and do all my meds and stuff, it's usually like 10-11 o'clock at night. And then everyone's usually like in bed, like relaxing and stuff. You might have like a random like pain med to give, a random like heparin to give. But then usually like we just, you know, sit and chart for a while. Sometimes I do chart at the bedside. We do have computers at the bedside, and I try to like, if they're there like for an abdominal surgery and they have drains and stuff, like I'll stay in the room and I'll chart like the bowel sounds, are they passing gas and everything. And then like any drain output and like what it looks like, any kind of wounds, like I'll chart that in the room, because that's like the more important stuff. But if it's like the person's like cognitively with it and stuff, like I'm not gonna sit there and chart like, okay, like they're alert and oriented like in the room, because like I can remember that, but sometimes like you can't remember like what their wounds look like and like what the drainage looks like and like how much the output is. So I usually at least chart that in the room when I'm actually doing my assessment. If they have crackles in their lungs or something, like I'll chart that too. If they're on oxygen, like I'll chart that too, because like I'm in the room looking at like the oxygen meter and I'm like, okay, they're on 2 liters, like I'm gonna chart that so I don't have to like come back in later and like look at that. So then at some point I usually like have a snack, and then basically after that it's kind of just like tasks. Like like, are you emptying drains? Are you taking people to the bathroom? Are you turning your people? And a lot of people say, you know, like nursing is very like task oriented, and like I try to not make it that way, but it's very hard when you start your shift at 7 p.m. and people like want to go to bed by like 9-10 p.m. and you're like running around for like 3-4 hours straight giving your meds and stuff that have due times. Like most meds are due at like 9 o'clock, so you have 2 hours. You have between 8 and 10 to give the meds, otherwise they're like overdue. So I try and do those like as quick as I can, and then like after that, then like if my patients are still awake, like I try to do it when I'm doing my assessment too, like try and get like an understanding of like their life, their background, their beliefs, like about their health and like their beliefs and what they know about like what's going on with them. And I try to build some kind of relationship with them, because like I will be with them for 12 hours and sometimes, you know, multiple shifts after that. So, you know, you have to like build a relationship while you're like looking in like every crack and crevice of their body. So like you can come in at like 1 in the morning and like have to like wipe their butt, and you know, like you wouldn't want like a stranger doing that. So like you have to build some kind of rapport with them and trust, because you don't want like a random person that's like not nice to you to like do that, you know what I mean? So like while you're doing your assessment and your meds and stuff, you need to be having a conversation with your patient, and you need to care about what they're saying. You're gonna be with them for the next 12 hours, so you better have like, you know, a good open communication line going, because you know, you don't want them to be unhappy and you don't want to be unhappy either. So it's important like right off the bat just to be like very friendly and nice, and like every time you go in there, just, you know, check on them, make sure they're good. And I try to clump things together overnight. So like if I have like a med to give, like I'll try and clump them together. If I have to do like a chem stick, if we have to do vital signs, try and do those like all together. And a chem stick, by the way, is just their blood sugar if they're diabetic. We do have some downtime at some parts overnight because like mainly our patients are sleeping. The main thing is like the assessment part of it, and make sure like we know what the patient's plan is, and make sure we're looking at them like holistically, like at every aspect of like what's going on. So if they're in for one thing, like multiple other things could occur. Like when they're in the hospital, they may have something new, like a new condition that's like starting with them. So it's always important to look at like every aspect of like what's going on with them. Like their labs are important. We always look at lab work. We have to like look at their medications, make sure they're getting like the appropriate medications, making sure that they're just like all around like good. And everyone's kind of like, every person, like every patient is like has their own thing going on. Like just because like two people had like the same abdominal surgery doesn't necessarily mean that like they're gonna progress like the same way. Like this one person may be like 20 years old and the next person may be like 80 years old, and like after surgery, you know, they had to be intubated or they have to be on oxygen longer, they can't get out of bed. Like that it really takes a toll when you're like an older adult compared to like a 20-year-old who's like a same day surgery or just like an overnight stay type thing. Like, and it really depends on like the age too, because that's a big thing. And on top of that, a lot of times we see like Spanish speaking only patients, and I'm lucky enough to know a little bit of Spanish. Shout out to Senora Payne from high school. I know like a good amount of Spanish, and I can like understand sometimes what they're saying, and then I say some words that don't always make sense together, but like we can have a conversation and it's functional, and that's always nice. But then there's some people that don't even speak Spanish or English, so that's hard. Some people that have like different religious views, some people that are nonverbal, some people that don't have like the mental capacity to like have conversations. But like no matter what the patient's age, race, culture, language, diagnosis, like comorbidities, whatever, like you have to gear the care towards them. Like it's all about them. Like the way you're gonna go and like care for one person is going to be completely different than the way you're going to go care for like your other 4 people. It's hard work to be a nurse. It really is. And you got to like think about all these things and all these like different aspects. So it is a lot of like critical thinking, and like, okay, you have to look at like lab values, vital signs, whatever, and you're like, okay, well, what am I gonna do with this information? Like you have to make decisions. Like, okay, this person's blood sugar is 60, or if it's like 90, you're gonna do something completely different than you would do if it's like 60, or like their blood pressure is 100 but they've been running low, so like, okay, we're just gonna like watch that, make sure they're not like symptomatic. But then like you have a patient who's had pressures in like the 150s, and now their pressure's in the 90s. Yeah, okay, we're gonna get some fluids and we're gonna call the doctor. Like you have to like make those decisions too along the way, depending on, you know, what happens. And then you have people that are combative, people that are just like not with it, so you got to deal with that all night sometimes. Every night's different. No one night, no 2 nights are the same. So yeah, but overall, like, I love it. I really do. I hope you enjoyed this video. I hope you have like a better understanding of what I do. Then I always take this to work too. It's a water bottle, like a reusable thing. I always take this to work too to keep myself hydrated throughout the night. But yeah, so it's getting dark out now and I'm going to dinner soon. So I hope y'all enjoy this video. Let me know if you have any questions about anything that I talked about, or, you know, whatever. But this was like a fun video to make because a lot of people don't like understand really what I do still. And I mean, this probably like maybe helped a little bit, but like unless you're like actually there witnessing the stuff that we do, like it's kind of hard to like know. But it is a lot of stuff. So yeah, so thank you for watching and have a great day or night.